This is Dr. Lindsay Van Dyke, and today we're going to talk about low-functioning thyroids. So over and underactive thyroids are extremely common, and these conditions appear most frequently in women. Underactive thyroid is most commonly due to Hashimoto's thyroiditis. This is an autoimmune disorder, but other causes of an underactive thyroid could be due to certain medications, tumors in the pituitary gland up in the brain, a temporary thyroiditis, which is an inflammation of the thyroid gland that can resolve on its own, or having thyroid surgery. Antibodies can be a part of this process, but they only really matter when a person has lab evidence or clinical evidence of thyroid dysfunction. When antibodies are present, but the thyroid function is normal, and this happens a lot because there's lots of doctors out there that do check antibodies, we do know that the risk of developing thyroid conditions are increased over the next few years. We cannot predict it, nor can we prevent it. So there's nothing to do in terms of supplements or dietary changes that would stop the progression of that process. Hashimoto's thyroiditis can be detected by a thyroid peroxidase antibody, also called TPO, and a large percentage of the population might have a positive TPO, upwards of 30%. But it doesn't count until that thyroid hormone production is affected. If a patient has positive antibodies, they are technically at risk for other autoimmune problems because antibodies are like birds of a feather that flock together. That being said, I take care of a lot of Hashimoto's or Graves' disease patients that have their thyroid disease as an isolated problem. Patients can tell their thyroid is underactive when they have these classic symptoms. These are the things we read about in medical school as being the perfect examples. Their symptoms can include puffy eyes, fatigue, depression, constipation. Sometimes the thyroid gets bigger and they can see it or they can feel it when they swallow. Periods can become heavier. They might complain of brain fog. Their heart rate can slow down, and they can feel cold all the time, even when friends and family are saying, it's fine in here, you're crazy. The important thing to remember is that thyroid symptoms represent a spectrum of disease that depends on how altered the hormone levels are. So it's important to look at the whole picture and address other causes for those symptoms too. All right, medications for an underactive thyroid. Levothyroxine is the generic medication for human thyroid hormone, or T4. It is synthetically produced, but I want to underscore that it is identical in structure to the hormone that we make ourselves. Our body converts that T4 to T3 as needed. That process is mediated by an enzyme in every cell of your body. There are exceedingly rare examples of people who are deficient in that enzyme that turns T4 into T3. I have never seen one in real life, but it is a textbook concept that they teach us in fellowship. Armour thyroid hormone is literally ground up, dehydrated pig thyroid gland. So those hormones that are contained in the pills are not identical to our own hormones. They do cross-react with the receptors in our own body, but not perfectly. It is also harder to adjust the dose because each pill can have different amounts of T4 and T3 in it. It is not my first recommendation, but some patients are very clear that that's the only medication that does work for them. So overall, it does work fine. Liothyronine, or Cytomel, is actually T3, and we never use this by itself. In fact, it's only used in very specific situations because the body is otherwise extremely good at converting T4 to T3 when needed. Using T3, especially in isolation, can increase the risk of heart palpitations and thinning bones. There are rules about taking thyroid hormone, so if you want to play by the rules, you should take it on an empty stomach without any other medications or food for at least 1 hour. Levothyroxine is an extremely stable, long-acting hormone, so the most important thing to remember is that you need to take it the same way every time. Sometimes patients take so many medications it's impossible to be able to change the dose and do this on an empty stomach. And in that case, if they're taking the medication consistently, we can adjust the dose as needed to meet the goals. If you forget a dose of levothyroxine, you can take 2 of them the next day. Certain medications or foods can interfere with T4 absorption. Classically, these are certain vitamins and minerals like iron, calcium, vitamin D. Dairy foods can do the same thing. Medications like omeprazole or Nexium. So when you take medications like this, you should separate them out significantly by at least 6 hours. I recommend to patients that they take the thyroid hormone in the morning and all the other stuff after dinner. How do we know if treatment is adequate? Well, once we have had sustained treatment for 6 to 8 weeks, we check that TSH and that free T4 again. And let's talk a little bit about the thyroid feedback loops that work normally. The signal begins in your brain in a gland called the pituitary. They call this the master gland because it manages all kinds of other glands in the body. And it makes TSH, or thyroid stimulating hormone, and its job is to tell the thyroid gland to do its job, make T4. When the thyroid does that, the circulating T4 in the body feeds back to that pituitary gland, so it shuts the TSH off. In a case of hypothyroidism, the gland can't make enough T4, or sometimes it can't make any T4. And so the pituitary gland is unable to appreciate any hormones circulating around, and so it asks again, and harder and harder and harder to try and make that thyroid gland do its job. In the most severe cases of hypothyroidism, the TSH is so high we can't even measure it. It's in the hundreds. And that's a really severe condition to have because this can become an emergency quite quickly. So when we replace thyroid hormone, those 2 signals will again balance out, but it does take time. When we test again and we find that the TSH and the free T4 numbers are right back in their normal ranges, and that is the Endocrine Society's recommendation that we hit the sweet spot with that TSH somewhere in that normal range, then we consider that a stable dose and we'll continue that dose. In the cases where symptoms persist, even when we know the thyroid numbers are right where they belong, then we have to go back to the drawing board and consider other causes for the symptoms. And we know this is true because the assays that the labs use now to measure TSH, free T4, these are 3rd generation, 4th generation. They're extremely precise. And the only exceptions to that are if we try to measure these things when somebody is acutely sick, or if the patient is also taking a supplement that contains biotin, because sometimes the labs use biotin to do the measurement of TSH. So those patients will get numbers that don't make any sense. It's not that you can't take biotin, it's just that when you take it, you need to stop the week before you have your thyroid hormones checked. Let all the biotin wash out, and then you can go back to it after the labs are done. If you have additional questions about hypothyroidism, you can always go to the American Thyroid Association at thyroid.org and the Mayo Clinic at mayoclinic.org.